Thank you all for coming. Let's see if we can get a few more people in here. It's a beautiful day outside. Hopefully everybody's gotten out and got some vitamin D injection today, free vitamin D, and have a cup of water on you. So, all right, we're going to go ahead and get started. Welcome to the PINK webinar, the second in the series. All right, let's see if I can get my slides this week. All right, the next week we have the fundamentals of joyful exercise, and after that is wellness within the context of illness. Last week we did our mindfulness training, and the webinar, the recording of that will be available at the end of the series of all of these. So if you missed that one, want to see it, it was amazing. You can catch it at the end when we email them all to you. Calendar of events this month, the Archival Gallery in Sacramento has an exhibit called Gone Fishing, and it's an exhibit with artists that have Parkinson's disease. It's absolutely beautiful. You can stop by. I would love you to go support. Big Day of Giving is our big giving day on May 4th. The PINK Support Group Facilitator Workshop is on May 6th, and the annual conference is on September 30th. So please put that on your calendar. It's going to be another fantastic event. So hope to see you all there. Just a couple of housekeeping issues. Just to let you know, you're all on mute. We can't see you or hear you. If you'd like to ask a question, we'll do that at the last 10 minutes of the session. Just type on the Q&A question at the bottom of your screen, and we'll get through as many questions as we possibly can. And once again, the recordings will be available at the end of the series. We'll send you all the recordings and any slides that we have. Today's speakers, we have Norika Malhado-Chang. She's a professor of neurology at the University of California, Davis School of Medicine in Sacramento. She's in her 15th year on the faculty at UC Davis, where she directs the clinical clerkship and sub-internship in neurology. Her passion is Parkinson's disease, teaching learners at all levels, and sharing her enthusiasm for neurology, Parkinson's disease, doctoring education. Her greatest joys are inspiring students to pursue a career in neurology and getting to know her patients and helping families navigate life with PD. Erin is a senior dietitian for UC Davis Medical Center in Sacramento. She provides evidence-based nutrition consultations to patients and their families to accommodate their current medical difficulties. She also collaborates with hospitals' interdisciplinary team on best service methods. She's worked for the Queen Valley Medical Center in Napa and the Shriners Hospital for Children. She's published articles, she does speaking engagements, and she loves bodybuilding, gardening, and cooking. So I'm going to go ahead and turn this over to Norika. Thank you so much for coming today, and I hope you all enjoy, and we'll see you at the end of the session.
Thank you so much, Jan. I really appreciate that kind introduction. I am so excited about this webinar series that PINK has put together. I think it's a real phenomenal way to celebrate Parkinson's Awareness Month here in April. And really, I love the themes of putting together 4 different ways that each and every one of us can take charge of our health and take charge of our futures with Parkinson's. So I'd like to introduce my colleague, Erin Nella. Erin, thank you so much for being here. Erin is a senior dietitian at UC Davis Health, and she specializes in neurosciences. She got her undergraduate degree from UC Davis and then went on to get do all of her postgraduate nutrition coursework and her internship from Tulane University in New Orleans. And she has been a dietitian now for 10 years, the last 7 of which have been with us at UC Davis. So we feel very fortunate for that. What I think is really special about Erin is she, it's really difficult when it comes to nutrition to differentiate between fact and fad. There's so much online with regard to nutrition and diets and things like that, and so many empty promises that you can find if you follow, a certain diet or have certain supplements, for example. And Erin is really committed to evidence-based nutrition. So that means following the research, following the data, and then sharing that data with patients and communities. And she presents at conferences all over Sacramento as well as nationally. And another thing that we have in common, I think, is our deep commitment to the community and to educating our patients, sharing knowledge. There's such empowerment to be had from education and from a deeper understanding of all these different facets of Parkinson's, nutrition being a really, really important one. You may have met her before because Erin has made various appearances at our Parkinson's support groups, at our annual education conference. She was a panelist for me a couple of years ago. And she has talked to support groups both in person as well as online. She's even done a virtual support group in Florida. And she really helps people understand the role of nutrition in Parkinson's and how controlling what we put into our bodies can really change the course of our future. And, we all know that eating is critical for survival, right? We need to eat to live, but how can these choices affect what our disease might look like in 5 years or in 10 years? And what I really want to hear is what is the research that's out there regarding diet and slowing progression of Parkinson's? Because I think that's the holy grail. How can we control the course of our disease by our meals every day and what we put into our bodies? Some other really important topics that Erin will go over is, how to control some tricky symptoms like levodopa off times or constipation. These are all things that are within our control. So I think that is really inspiring and hopeful. And I invite you to listen to the latest research that Erin is going to present on the role of nutrition in Parkinson's. So thank you again, Erin. All yours.
Thank you for the kind introduction. And I'm really excited to be here and to present to all of you. It's really an honor. And I've built this presentation several years ago and have kind of morphed it and adapted it as time has gone on and as we learn more about the role of nutrition in Parkinson's. So I hope to address your many questions today, and we'll have time to answer additional questions at the end. So definitely, if you think of something you want to know, throw it into the Q&A section and we'll try and address as much of it as we can. And I'll try and I can really ramble on about nutrition and Parkinson's for a long time. So I'm going to try my best to keep it condensed and to the point. So you know exactly what we're going to go over and what kind of questions you might have, you can share with me then. So let's go ahead and get this started. Okay, and if you can't hear me or if you have any technical difficulties, just let me know along the way. All right, great. So we'll go ahead and get started. And my objectives today are to understand the role of nutrition with Parkinson's, to learn some tips and tricks for symptom management, review research ideas on improving the efficacy of levodopa using nutrition, as well as introducing some emerging research trends in Parkinson's nutrition, like the ketogenic diet. And I always have to include this disclaimer at any group that I speak with, that like medical therapy, nutrition therapy is best when it's individualized. So especially with Parkinson's, as through the progression in our lives with Parkinson's, things change for us, or can change for us fairly dramatically. And as such, your nutrition, what I would recommend to you if we were speaking one-on-one might be a little bit different versus this larger group setting. So some of the things we talk about today may or may not apply to you and where you're at. I just want you to keep that in mind, that some of these things you may need to take with a bigger grain of salt than others, as I try to address, where everyone could be at and what might be helpful for each and every one of you. So let's go over some golden principles of when it comes to nutrition and Parkinson's. So first things first, I always have to, I'll remind this to you at the end as well, but adequate nutrition always supersedes smaller diet modifications. It is always more important to get enough to eat than to worry about the details of what you're eating. So if you're not having a difficult time getting in enough nutrition, we won't worry so much about what you're eating as long as you're getting enough of it. So that's the kind of the golden rule of nutrition in any disease or condition, and Parkinson's is no exception to that. So a little bit more on that that's specific to Parkinson's. When we think about the consequences of not getting enough nutrition, there's an increased risk of weight loss and malnutrition with dyskinesia. And this can be especially the case with medications, including levodopa and dopamine agonists. And muscle loss in the setting of Parkinson's is associated with worsening disease symptoms. So oftentimes, if we're not getting in enough calories and enough protein, our bodies are a little bit at higher risk to lose their muscle stores. And this has a special implication with Parkinson's. And in early Parkinsonism, unintentional weight loss is associated with increased dependence later on in the disease. So when you're not trying to lose weight, but unable to stop losing weight, it has its own sets of consequences, especially early on. And unintentional weight loss, again, is also associated with loss of dopaminergic function. So those dopamine neurons that we rely on and we're concerned with Parkinson's. And again, this is all unintentional weight loss. Of course, if you're trying to achieve like a healthy weight loss or get towards a healthy weight, that's something very different. This is all, I don't want to lose weight. I cannot stop losing weight. Those are the things, those are the areas that we are concerned about. And a little bit more on that. So eating with ease. So there's, if you're finding that you're having a hard time maintaining weight, what we really want to do is just to increase calories any way that we can. So the easiest way to do that is to add fat. Fat is very calorie dense. Those could be adding things like peanut butter to a smoothie, adding additional oils or butters or heavy cream. Those things can help increase calories. It can help keep you from losing weight. When it comes to increasing protein, especially as maybe chewing becomes a little bit more difficult, those big hunk of grilled chicken breasts might be a little bit difficult to work on. So using things like protein powder or even like dried milk powder, that tends to dissolve and blend really well in like soups or cream of wheat. And those are ways to increase your protein as well if you're having issues with losing your muscle and your strength. Now, if you're having a difficult time eating a wide variety of foods, particularly like fruits and vegetables, because some of these can be more difficult to, a multivitamin with minerals may be helpful. And this is just sort of like a general insurance plan in terms of like getting nutrition adequacy. A chewable or liquid also can be good options. The only drawback to these is that you want to look for ones that include minerals, especially zinc and potassium, as these are often not included in chewable and liquid multivitamins because they tend to taste relatively strongly. So those big horse pill multivitamins, those are going to be the ones to look for. Again, this is if you're really not able to eat, different fruits and vegetables throughout the day because they're really challenging for you. Then we might want to think about this a little bit more carefully. With any supplement, so supplements unfortunately are not regulated by the FDA. The FDA does not look at supplements, does not look at how they're made, does not look at what's in them, what they're being advertised to do. There is zero regulation. There's no guarantee that anything you buy will do anything that it says it will or contains anything that it should. So what I want you to do, if you're ever buying any kind of supplement, herbal or multivitamin or probiotic, you want to look for a little bit more scrutiny from some outside organization. So I have a label on the slide here that says USP verified. So that's one third-party organization that helps look at different supplements and do some testing to make sure that they contain what they say they contain. Another label to look for is NSF. So those are different companies, outside companies that take a closer look at supplements to make sure that you're getting what you're paying for. Now, they do not test statements like that. If I take zinc supplement, I'll grow wings and fly. And they do not test to make sure that those statements are accurate. They just test to make sure that if you buy a zinc supplement, that it actually contains zinc in it. So here's my favorite part is talking about medical nutrition therapy for Parkinson's. So what is the research looking at? What are the foods that I can eat that might be associated with delayed disease progression? So a lot of this research is what we call a prospective cohort study. So these are large groups of individuals that are followed for several years, and they look at what kinds of foods they're eating by checking a food frequency questionnaire. It's like, okay, how many times per week do you eat this versus that? And they follow these people along and check their, disease severity scores along the way. And what they have found in one study that was published in 2017, a slower rate of Parkinson's progression in individuals who had higher intakes of fresh vegetables, fresh fruit, nuts and seeds, non-fried fish, olive oil, wine, coconut oil, fresh herbs, and spices. And then on the flip side, they found a faster rate of Parkinson's progression with higher intakes of canned fruits and vegetables, diet and non-diet soda, fried foods, beef, and to a lesser extent, dairy. So dairy kind of fell right in the middle, just on the slightly edge of slightly fast rate progression. But I would call that an insignificant result, but because it was there, I wanted to relay that to you as well. Now, in 2018, there was a smaller group that was followed along and were educated on what they called a MIND diet. So MIND is an acronym that stands for the Mediterranean Diet Intervention for Neurodegenerative Delay. It's a mouthful, so the MIND is a lot easier to understand. The MIND diet is essentially a Mediterranean diet with a special encouragement of like daily berry consumption. So it would be a diet I would describe as being higher in, whole grains throughout the day, fruits and vegetables at all meals, using olive oil instead of butter, lots of herbs and especially berries, especially blueberries and strawberries, particular focus on those included through the day, throughout your day. Now, there's not a lot of randomized controlled trial research when it comes to nutrition because it's difficult to control for people's eating habits, because a lot of us just eat what we want throughout the day as part of being, a human and having wants and desires. But there have been some of these trials out there. So one single center randomized controlled trial looked at the benefits of a Mediterranean diet in the setting of Parkinson's and found that those who best adhered to a Mediterranean diet had an overall reduced disease severity score with their Parkinson's disease. So there could be some benefit to that. Now in 2022, so this is actually kind of an addition off of that 2017 study I mentioned earlier. So a few more participants, we're looking at 1,200 participants now. And instead of looking at individual components of foods, they looked at adherence to either a Mediterranean or a MIND diet and how that influenced Parkinson's symptoms, and found that both diets actually had an association with fewer reported symptoms over time, with a possible slightly stronger benefit with the MIND diet. So that's kind of when we talk about nutrition therapy, where if you ask me what's the best diet for Parkinson's, this is probably what I would tell you. I want your day to look like whole grains at each of your meals. I want it to look like fresh fruits and vegetables at all of your meals as well, including some fish, cooking with olive oil, lots of herbs and spices to make it delicious, and with an emphasis again on blueberries and strawberries, and they're yummy as well, so double win. Now, when we talk about, in terms of medical nutrition therapy, I'm going to leave talking about the ketogenic diet until towards the end, because it's a little bit more, a little less well established, I think, but just so in case you're wondering where that is, that will come later. Now, when we're talking about nutrition for symptom management, constipation is always the big one. I will start by telling you that pooping is very important. It's good to poop regularly. In Parkinson's, intestinal inflammation and pathology may actually come before those nervous system changes we get years down the road. So constipation is the most common symptom of this intestinal inflammation. So meaning that Parkinson's may, in some cases, they feel it may actually start in the gut. Now, how we manage constipation, of course, using bowel care is needed. So, ideally, we don't want anybody going more than 3 days without a bowel movement. Closer to daily bowel movements is ideal. And what can help this is good fiber and good water. So, if we think of our intestines as like a nice tube, you want to use fiber as your sponge, and you want to add water to the sponge to help get that tube nice and clean. So you want to see at least 20 to 30 grams of fiber per day. And, what does that look like? Like a half a cup of beans probably has 6 grams of fiber in it. Half a cup of cooked vegetables probably has 3 to 4 grams of fiber. But whole grains also can contain a lot of fiber. So there's additional benefits in terms of these foods maybe being helpful for disease progression with Parkinson's, as well as helping maintain adequate regularity. But whenever you have fiber, you always need to have water because a dry sponge is not very helpful. So one note about fiber supplements, when it comes to bowel regularity, just strictly bowel regularity, there's a lot of fiber supplements on the market, and a lot of things like Fiber One bars or foods that have added fiber to them. They usually use something like inulin. So those types of fiber dissolve really well, and so you don't really taste that they're there, which is nice, but they are not particularly helpful for bowel regularity. Things that are more helpful could be psyllium husk. Commonly the common brand people use would be like Metamucil or like a coarse wheat bran. But even adding like bran cereal to your morning oatmeal or whatever you like to eat can help with bowel regularity as well. Because different types of fiber have different benefits when we're looking at like microbiome benefits or bowel movement benefits. So this is just a little bit about bowel movement benefits with fiber and what we're looking at there. So early satiety is a fancy way of saying I get full really quickly when I eat. So there is some good evidence to suggest that people with Parkinson's are at higher risk for their stomach not emptying as fast as it should, or as fast as what is considered normal. This appears to be a little bit more prevalent in the later stages of Parkinson's. And to give you like some kind of context, the general population, when we look at gastric emptying time, so how long it takes for things to empty out of your stomach, fluids take about 30 minutes and solid foods about 2 hours. So people with Parkinson's, this can be delayed 4 to 6 hours. It could be 8 hours. It could be even longer. So what this looks like is, again, I begin to eat. I don't eat as much as I used to, but I feel really full. So if this is happening for you, this can be a risk factor for, again, unintentional weight loss and not getting adequate nutrition. So what we want you to focus on is small, frequent meals. So since you're not able to eat as much of a big meal, we want you to have little nutritionally dense snacks throughout the day. Sitting up straight for at least 30 minutes following a meal can allow gravity to assist the process. And then focusing on more nutrient-rich or nutrient-dense beverages. So this could be smoothies, protein shakes, soups, cream of wheat, again, to kind of focus on the fluids will move through a little bit faster. So if you make those a bit more, if your diet is more liquidy, it could help you get in enough nutrition and worry a little bit less about that delayed gastric emptying. Now, when we talk about making levodopa work, because I know this is something that a lot of us have concerns about, or a lot of us care about, is how can I make this medication work better for me? So Sinemet is our most commonly prescribed version of this, and how the influence of levodopa and protein is always been like a really hot topic in Parkinson's nutrition research. So again, just to kind of reiterate, like levodopa should be consumed on a largely empty stomach, either 30 minutes before or 2 hours after a meal. This is tricky if you have delayed gastric emptying, so that that number may need to change a little bit depending on if your stomach isn't emptying as quickly as it used to. Again, some people might feel nauseous, so having a low protein snack like crackers or a piece of fruit can help. It can help manage the nausea if you have a slight intolerance to the levodopa. And then again, another caution with iron supplementation. So if you are someone who's taking a multivitamin with minerals that contains iron, that too needs to be separated from levodopa administration because it does compete for absorption. So levodopa is structurally similar to certain proteins that also may compete for absorption and utilization. There have been several strategies looking at how we can address this. And one of the options was a low protein diet, but time and time again, sometimes people have found low protein diets to be helpful with reducing off times and that interaction of protein and levodopa. But unfortunately, it was associated with such significant weight loss and debility from muscle loss that it's kind of become quite discouraged in the literature. Now we focus on what we call a protein redistribution diet. So a protein redistribution diet is where your daily amount of protein is to be consumed at the last meal of the day. So if you're someone who feels like levodopa, my on times are kind of being affected by my food, and I think maybe my protein foods are interacting with my levodopa and how well those are working, how well it's working for me, it could be helpful to try and eat the bulk of your protein foods at dinner. So this requires a bit more meal planning. It can be a little bit more difficult than just eliminating protein altogether. But for people who have found that protein foods might be affecting levodopa effectiveness, they found that it can help ameliorate motor fluctuation symptoms from, between 38 to 80% improvement. There could be some benefit to this in helping with those on and off times. So again, your protein foods like your beans, nuts, fish, chicken, eggs, cheese, those things should all be consumed at dinner when you're maybe a little less worried about your on and off time variability. So what that might look like is you have your oatmeal with your berries, some sliced almonds in the morning. Lunch could be a pasta with a cream sauce and some veggies on top. And then dinner, you have your big hunk of salmon, and then your post-dinner peanut butter protein smoothie. So that would be kind of what we would look at, or what a protein redistribution diet could look like. So this is kind of a newer topic. So homocysteine is something we look at in terms of from a nutrition lab standpoint that has it has an association with like cardiovascular disease that we kind of can get concerned about. Now, in the context of Parkinson's disease, high homocysteine levels are associated with peripheral neuropathy, osteoporosis, cognitive decline, and a few other concerns. So levodopa metabolism it has an interaction with homocysteine metabolism, where as you take more and more levodopa over time, this can lead to significantly higher levels of homocysteine. So that it does raise some concerns when it comes to, again, like peripheral neuropathy and other issues that we think about as we continue to live long, healthy, wonderful lives. Now, the one thing I can tell you about homocysteine is that it does have an inverse relationship with B vitamins, specifically B12 and folic acid. So those, and as well as vitamin B6, those three things can be helpful for, assisting the breakdown of homocysteine, keeping those levels lower, and to reduce some of those reduce an additional risk factor for some of these other complications. So sometimes some research has looked at, supplementation with a B complex multivitamin may be helpful for reducing homocysteine levels over time. So this could be that maybe we just take a B complex every day, or maybe we decide that we want to have our homocysteine levels checked, making sure that our insurance will cover for it, because all labs can be kind of expensive. And to make sure that those levels are all normal. But again, it could be as simple as just taking a B complex every day make sure that have one less thing to worry about. There could be some additional benefit to taking in vitamin D and DHA, which is like a component of fish oil. But I do want to issue caution with vitamin C. There has been some research looking at vitamin C and levodopa to, again, manage these homocysteine levels. But some of these nutrients can be a little riskier if you have like chronic kidney disease, especially vitamin C. So always better to talk with your providers first before beginning any type of supplementation. So levodopa and fiber. So we already talked about poop once. Let's do it again for good measure. So people with Parkinson, you know that the overall country has very, very low intakes of fiber. It's a nutrient of concern with the, it's a listed nutrient of concern with the USDA, in that many people just don't get enough of it. So there's been some research looking specifically at people with Parkinson's who were educated to increase their fiber intake from 10 grams to closer to 28 grams per day. And while they all had significant improvements in constipation, they also had significantly higher levels of plasma levodopa. Something about that additional fiber intake helped make those levodopa concentrations stable and a little bit longer throughout the day. So one particular study looked at using psyllium husk and found that adding psyllium husk in the morning, like let's say you throw it on your oatmeal, led to higher, more stable concentrations of levodopa. Now, whether the benefit was in the psyllium husk specifically or just that added fiber content, can't really pinpoint that, but what we can say is that there's possibly a help of just having a little extra fiber throughout your day to, one, help with the constipation, but also to maybe keep higher, more stable plasma levels of levodopa as well. So when we talk a little bit more about supplements and emerging research trends in Parkinson's, that we're going to talk about the big hot topic here. I'm sorry, I meant to have these come one at a time so it's less overwhelming, but it's all here, so here we go. So the ketogenic diet. This is so being a neuroscience dietitian, I'm extremely familiar with the ketogenic diet because we use it as a therapeutic strategy to address seizures and epilepsy. Now, so it's been used for years for that specific area of the neuroscience world, but it's become a huge area of interest in other disease states, and Parkinson's being one of them. Unfortunately, this diet can be extremely challenging to follow. A true ketogenic diet requires the use of a food scale to accurately measure and weigh each gram of carbohydrate, fat, and protein consumed. If you're following a ketogenic diet, that includes severe limitations on carbohydrate as well as protein intake. The diet looks like lots of heavy cream, lots of fatty meats or fish, avocado and oils or cheese, and basically no fruit. Very, very small amounts of low carbohydrate vegetables. And your primary fuel source, again, is fat. So your breakfast might be like a big scoop of cheese over a fried egg in lots of oil with poured heavy cream on top and half of an avocado. So that would kind of be what a ketogenic diet may look like. Now, there are some long-term concerns with eating like that, as you can imagine, but there are some possible benefits with it as well. So it's still, at this point, we're in the very early stages of this research. It's difficult to pinpoint if there is a benefit and why that benefit may occur. And what we want to kind of differentiate, so people will follow a ketogenic diet to go into ketosis. So ketosis is when your body relies on a fuel source called ketone bodies. So generally speaking, our bodies run on glucose, run on carbohydrate. Now, when we switch our metabolism to burn fats, that is when your body is in ketosis and runs on predominantly ketone bodies. Now, when we look at like ketogenic diet benefit and potential benefit, it's hard to say whether you have to be in full-blown ketosis or if just having the additional presence of ketone bodies has some sort of benefit. So do you need to be in like do you need to follow a ketogenic diet strictly, or do you just need to have some extra ketone bodies hanging around? And we don't know how to differentiate that. So the potential benefit in Parkinson's could be related to, as we get older, we have a reduced metabolic rate of glucose in our brains. So our brains have a reduced ability to utilize glucose and burn through lots of glucose as we get older. And in Parkinson's, we worry about mitochondrial dysfunction. Your mitochondria are like a little component within your cells that help manage fuel for your body and your brain. So when we think about Parkinson's disease, sometimes we worry about there being a mitochondrial dysfunction with that. So there's very limited clinical research in Parkinson's, and there's no study to date looking at long-term implications. And some trials have even compared a low-fat to a ketogenic diet, in which both were actually found to have improvements on motor function, but there were better improvements in non-motor functions with the ketogenic diet. And the largest study to date has probably, I think, less than 10 participants. So these studies are extremely small, and the longest one only lasted about 8 weeks. And with, other research looking at the ketogenic diet will tell you that there are some concerns with weight loss and worsening debility over time because of the weight loss and the muscle loss that's often accompanying this diet. So I know that sounds a little doom and gloom and kind of difficult, but the good news is that simply, not eating food at night and when you sleep may induce relative periods of brain ketosis. So while it would take a couple of days for your body to be in ketosis, your brain burns through glucose a little bit faster. So after about 5 to 10 hours of not eating, like when you're sleeping at night, your brain is likely already in ketosis to some degree. Some studies have found that even just taking like some MCT oil or like using coconut oil in your cooking may be enough to supply ketone bodies for their possible neuroprotective properties. And additionally, exercise can induce relative ketosis as well as improve insulin resistance. So there's lots of good research looking at the benefits of exercise in Parkinson's, and part of it could be related to this, or it certainly might be an additional benefit. So my takeaway from here is, the ketogenic diet is a very exciting area of research and most people are really invested in. There's not a lot of good quality research at this point, and there's no specific recommendations I could give about a ketogenic diet in terms of what would be a short-term or long-term benefit. It's possible that just increasing your exercise throughout the day or using coconut oil in your cooking for one of your meals could be enough to give you the benefits that the ketogenic diet could provide. So there are some maybe just easy things to try just to see if you're finding a specific benefit to that. Now, the microbiome is another real hot topic of research, Parkinson's and outside of Parkinson's. And so what is a microbiome? So your microbiome is the collection of bugs, if you will, that are the non-human cells present largely in your gut. So this is like largely in your colon. This is bacteria and fungi and viruses and other prokaryotes that are all hanging out in your gut. So there's been a lot of research looking at, your microbiome pattern. What we have found is that people with Parkinson's kind of have some similar microbiome changes. It's unclear if having Parkinson's changes your microbiome to look a certain kind of a way, or if a certain type of microbiome predisposes you to Parkinson's disease. The chicken and the egg game is a big challenge that the microbiome research field is struggling with. So some studies have found that having more pathogenic bacteria, or what we call like bad bacteria, may increase Parkinson's disease severity. And when we talk about the best way to modify your microbiome, the one way that most surefire can change your microbiome is to change your diet. So your non-human cells rely on the fuel that you eat in order to fuel themselves. So things, again, I like to talk about fiber a lot because it just comes up so much in the research, but the fiber is one sure way to modify your microbiome. So daily consistent changes will cause positive or negative microbiome changes as well. So if you increase your intake of fermented foods and increase the amount of fiber in your diet, that is one way that we have seen consistent research to improve the diversity and the profile of your microbiome. So if you like things like kefir or kimchi, those are foods that could be helpful to make a more healthful microbiome profile, which may have some benefit on Parkinson's disease severity. Now, I do want to issue a cautionary tale with probiotics because it is quickly becoming, actually, in fact, that it already is a billion-dollar industry. And if anything should make you concerned, it's things that make a lot of money. It's, again, like I mentioned before with other supplements, this is not regulated at all. And it, even especially with probiotics, when you're taking a capsule of live bacteria, there are a little bit more risk than just taking a vitamin D supplement associated with taking a capsule of bugs. So the lack of regulation is a little bit more of a concern when it comes to probiotic supplements. Another concern with probiotics is they tend to colonize the small intestine instead of reaching the colon. And in Parkinson's, this has a special amount of risk because of a condition we call SIBO, or small intestinal bacterial overgrowth, where you get an overabundance of bacteria or bugs of some kind in your small intestine instead of where they should be, which is predominantly in your colon. So the incidence of SIBO in people with Parkinson's is up to 50%. And in SIBO, those who have experienced SIBO have been found to possibly have greater motor impairment. So they don't tend to move as well. So that's another possible concern with taking probiotics. Now, probiotic is generally 1 to 4 strains of microbes at most. When you have trillions of microbes in your gut and thousands of different strains and types, so it's really hard to say if 4 strains out of thousands of potentials is really a good change. It's like if you're looking at the ocean and there's, you normally have like kelp and fish and otters and whales and sharks, and then you decide to add 1 trillion sharks into the ocean. That obviously is not something we're going to think of as a significant benefit. We understand that sharks are important for the ecosystem, but we're losing sight of the whole picture. So again, probiotics, just want to make sure you're cautious and you're mindful with it, that maybe there is a benefit, but it's a little bit trickier than that. So again, microbiome research has found more significant and longer lasting results with prebiotic supplement or prebiotic foods like higher fiber foods and fermented foods. Again, there's possible benefits to probiotics, but there's not really good research. And I would say nothing is proven at this point. So to summarize, the best diet to date is a diet that we would consider rich in omega-3s, so rich in fish, preferably like lower mercury fish, where I'm thinking like salmon or sardines or anchovies even. A diet that has lots of fresh fruits, fresh vegetables, fiber-rich grains, beans, nuts, and berries. Especially for women, actually, some of the berry research has found a greater benefit for the ladies compared to the gentlemen. Other things that may help. So lemon juice is something that's been looked at in levodopa administration. So if you like lemon water, that can also be a help. And psyllium husk, or better yet, just increase your intake of high fiber foods. And things that don't help is not getting enough to eat. Again, so at the end of this, I just want to remind you that getting enough to eat is always the most important concept that we have with nutrition research, especially nutrition research with Parkinson's. So I always want you to make sure that we're getting, don't worry about eating blueberries every day if you're having a difficulty just getting enough food to begin with. Getting enough to eat is always going to be the most helpful thing you can do. And if you're finding that you have enough to eat and you want to make some changes, I hope there are some options in here that you learned that might be helpful for you in your health for 5, 10, 20 years from now. So these are some of the articles I've used to create this presentation. Let's go through those real fast. Okay, and I will stop sharing my screen and start taking your questions.
Erin, that was fantastic. Thank you so much. Like, I learned so much, so informative. Your graphics are spot on, and everybody needs to know this information. This is really like outstanding. Good job. And I'm so glad I'm sitting here eating my bowl of raspberries instead of the Girl Scout cookie. So anyway, thank you so much. While we're waiting for questions to come in, if people want additional information about this, if they want to take it to the next step, do you recommend, do you have a book that you love or a certain website, or if you could give us some resources?
I wish I had a book that I really liked. I think it just depends on what you're looking for. If you're having trouble chewing and swallowing, you can actually just like Google dysphagia cookbooks, and there's a lot of good recipes and resources out there that were written by like dietitians and speech pathologists. There's not a lot of good patient-centered resources. I think like the Michael J. Fox Foundation and Parkinson's Foundation do have some resources on their websites regarding nutrition that I think are helpful. So that would probably be my best recommendation. Usually like the stuff I get is like articles or like textbooks. So not quite as reader friendly, if you will, but I think that those two organizations do a pretty good job of making recommendations regarding nutrition.
Wonderful. Great. Thank you. So our first question, Madeline, would it be more beneficial to eat raw or cooked vegetables?
That's a great question, and either are great. I think there are always there are benefits to both ways. When we have water-soluble nutrients, those are, best consumed, those are better absorbed raw, or you get more of them raw, but fat-soluble vitamins, those are better, absorbed cooked with some oil. So I think as long as you're getting a healthy variety of both, you're doing great. And I think they both have benefits. And the best vegetable is the one that you eat, right? So better than just not eating anything. Just go ahead and however you want it or however you like it, enjoy it that way.
All right, fair enough. Janine, can you address caffeine coffee benefits with PD?
Yes. I was trying to trim down the presentations. I didn't include my coffee slide, but there is like specific research and benefit to coffee. One article that always makes me laugh is they're like, yay, coffee. They're like coffee intake in people with Parkinson's improves awakeness. I'm like, wow, coffee makes you awake. Who would have thought? So but outside of that, yes, there is some research for coffee intake in terms of like managing like Parkinson's symptoms and focus. So yes, drink your coffee. It sounds wonderful. And it helps with pooping. Helps with pooping too. So it's like a double win. I'm awake and I'm regular.
Okay, it's a good day still. So awesome. Thank you.
Yes.
Miralax, Denise, good fiber colon help? Yes or no?
Yes, I actually created the bowel management guidelines for our neuro ICU here, and we use Miralax a lot. Yeah, I think Miralax works well. Senna works well. The only one I don't recommend is Colace or Docusate. I don't think there's good evidence for that particular stool softener. So one of the other ones I think is a better bet for you.
Okay, awesome. All right, Nancy, please explain how lemon water aids those. How about the other fruit flavored waters?
Yeah, I know. I was like trying to like condense everything. So I have a slide on lemon. So people with Parkinson's, some people with Parkinson's have reduced gastric acid secretion. Their stomachs aren't quite as acidic as like a general healthy adult. And there's some research to suggest that levodopa is better absorbed in a more acidic environment. So when they looked at trials at addressing this, they have found that people with Parkinson's who don't make as much stomach acid, if they have like a little lemon water or like an ounce of lemon juice, and again, does it have to be lemon? I don't know, probably not, but just bear with me. People who had like some lemon water or an ounce of lemon juice with the levodopa found to have slightly higher plasma concentrations of levodopa. So how does this translate to like symptoms? No, the research was just looking at like plasma concentrations, but that's where that comes from. So the little bit of extra acidity may help people who don't make as much acid, might help with that absorption. So there's a lot of contingency there, but that's the possible benefit with that. So if you like, fruit water, give it a whirl, see if it helps. It could help with the nausea too. A little extra something there. That's a really good question. Good eyes.
Great question. That's a good question.
In there at the very end, I was like, someone got it.
Any insight about supplementation with NAC? And I don't know. Acetylcysteine, sorry.
Acetylcysteine, is that it, or acetoacetate? So acetoacetate is
acetylcysteine.
Acetylcysteine.
Yeah.
Yeah, I would say there's not a lot of clear evidence for that. And again, I always, so my usual take with supplements is if you find that it works for you and it's not going to interact with your other medications, then I think that's great. There's not a lot of specific research with acetylcysteine, but I think again, if you feel like it's helping you, then I think that I think that's great. I wish I had like a better answer for you. But generally that's my general approach with supplements, but there certainly could be a benefit. And I'm sure that there is research being done and we will have answers at some point in the future to kind of help paint that picture.
Okay. Awesome. We have one more question. If anybody has questions, go ahead and type them in now. And then I do want to hear from Dr. Malhado-Chang and see if she has anything to add. So last question, how unintended weight loss affects levodopa effect?
Oh, that's a good question. I don't know if there's actually specific research looking at weight loss and levodopa. The research looking at unintentional weight loss is really just in looking at your general ability to function and your debility, so becoming debilitated over time. And most of the time when you have unintentional weight loss, the part of the cause is that as you are just losing weight, can't maintain weight, your body tends to, and if you've ever like dieted before to try and lose weight, what people find is that you lose fat, but you also lose muscle. It's really hard to preserve your muscle when you're losing weight. So, the same thing when you have an unintentional weight loss is that people, especially in the context of any kind of inflammatory state, your muscle tends to be the thing that you lose the fastest, unfortunately. So it's really hard to preserve muscle mass. So it's pinpointing or differentiating, what is more, what is the cause of the debility is kind of harder to say. Now, levodopa, there's some evidence to suggest it could increase the breakdown of your nutrient storage. Like lipolysis is the breakdown of lipids, which is also known as the breakdown of fats. That's another way that it can influence weight loss down the road. So that's kind of I hope that helps answer that question.
That's great. No, it's great. Thank you. We did get one more. Lori, any recommendations for me? I'm diabetic, have PD, CHF, and poor fitness gestures, so I can't chew.
Yeah, wow, that's you're going through a lot right now. I'm sorry. So I would focus again, principles, adequate nutrition first. With CHF, you do want to be mindful of your salt intake. This can be a little tricky when you're balancing, if you're finding that you're getting like orthostatic hypotension or you get lightheaded when you get up. So just kind of finding the right balance there. But, most importantly, we want your heart to be taken care of. So be careful with your salt and your fluid intake. And then from a diabetes perspective, we just don't want you getting too carried away with the carb-rich foods. So what I would like kind of think is your diet would be like softer things like egg salad, tuna salad, salmon salad, looking at softer, carbs like oatmeal that are going to have some fiber in it. Fiber delays carbohydrate digestion and sugar absorption. So instead of, your blood sugar is doing like the mountain climber, we want to keep things nice and steady. So a little extra fiber slows that sugar absorption, and just finding those softer fibery foods, like whether this is like mashed beans that have some carbs, some healthy, but with lots of fiber, and then some soft proteins. And then again, just being really mindful about, especially if you're buying like, canned things, just be mindful of salt intake. Yeah, it's a good question. And then soft cooked vegetables and soft fruit like raspberries, those are wonderful, really high in fiber too. So that would be kind of that would kind of be my quick and dirty approach to that. I hope that was helpful.
That was great. Thank you. Norika, do you have anything to add? We have a few minutes.
Oh, this is just so phenomenal, Erin. Thank you so much. I feel like you're such a wealth of information. This is one of the things that we're in the works, that is in the works at UC Davis, is trying to recruit Erin to see some patients in our clinic and have some consultations where you can meet with Erin one-on-one to discuss your dietary concerns with Parkinson's. You covered such a breadth of issues during this short period of time. I totally agree with what you're saying about number one, adequate nutrition. I actually have run into many patients who have lost weight as a combination of both motor complications like dyskinesias. Dyskinesias cause you to lose weight, but then the avoidance of protein, right? And I love your plan about the redistribution of protein and kind of laying out the daily menu of how that might look like in terms of putting more of your protein cluster towards the end of the day, for example, so it doesn't interfere as much with your levodopa doses. Loved what you were saying about fiber and regularity and the difference between prebiotics and probiotics and how not everything is created equal when it comes to supplementation. I think your the data you presented on some of the foods that are associated with faster progression of Parkinson's versus slower, I think was really interesting. So goodness, I mean, I can go on and on. That you just made so many really great points. Thank you so much. I feel like we will have we definitely need you more regularly in our clinic, and we're going to try to arrange that. Parkinson's has been, I think it's been a misnomer all these years to call Parkinson's a movement disorder, because movement is only one aspect of Parkinson's. Parkinson's is multisystemic, and diet and intestines and digestion is a huge part of it. When digestion is not regulated properly, that in turn worsens your motor symptoms, right? It affects your levodopa levels, it affects your sleep, it affects your mood, and it's like a domino effect. So yeah, we could call Parkinson's a digestion disorder, among many other things. So, but thank you so much. I think this was wonderful.
Mm-hmm. Yeah, this is fantastic. Ladies, both of you, thank you so much. We were all so lucky to be here, and I hope you all enjoyed it. We'll get this recording to you. Please share it. Great information. Have a great day. Hope to see you all next week. Thanks again.
Thank you, everyone. Thank you.
Thank you.